And welcome back. It's about 54 minutes past the hour, 9 o'clock on this Wednesday, last Wednesday in January. Thanks so much for being with us. Cabinet Secretary for Health Aden Duale is on the bench after a headline in today's papers that said 11 billion shillings looted from shop. By the way, CS, in any civilized society, if a headline like this was screaming out there, the health CS would have resigned. In China, you would be in jail today.
Why?
Because the buck stops with you.
Of course, the buck stops with me. And it's us who rejected the 11.6 billion rejected fraudulent claims. And that's why I'm the Minister for Health. And out of the rejected claims, the 11 billion, the highest figure is with the private health facility providers, 6.8 billion. The ones are rejected. The county government's about 2.8 billion. That's the public health facilities. The faith-based is about 1.1. And my own referrals. Ministry of Health run referrals. The Kenyatta Hospital, the MTRH, Jaramogi, Kenyatta University, Mathare, put them together, Odaya, about 450
million.
No, I think it's about 500 million.
Tell me something.
The rejection and fraud in the insurance industry is a global problem. And so we are not exceptional. In that, if I give you global statistics, maybe I picked on 3 countries. In India, globally, average is 14%, rejections and fraud. But in India, is about 11% as per 2023. In the US, it's about 20%. Estonia is a small country, is about 6%. And they have got very good digital system. Digitization is the key to insurance fraud. These rejections, what are they? Okay? And why do we reject? The system, the digital health system, detects patterns. So when you lodge your claims, first it will ask you, where are your invoices? You lodge your claims and invoices. It will first confirm whether the facility is legally in existence. Does it have a contract with the Social Health Authority? Has it been licensed by the regulator, Kenya Medical Practitioners and Dentists Council or the Clinical Council of Kenya? Then it is studies. So one of the 3 to 4 main reasons why rejections have happened, and these have happened during the initial first 6 months of SHA, October 2024 all the way to April. When I came in as the Minister for Health, I came in April, I think 17th, around there. You will find people who claim for maternity. The benefit tariff for a C-section, if a mother delivers through a C-section, the benefit is 30,000. For normal delivery, SHA reimburses 10,000 to facilities. Now, because of greed and because of fraud, and facilities some of the people are not intelligent, the WHO and international standard is that C-sections is between 10 to 15%. So you'll find a facility submitting 99% of the deliveries in their facility was C-section. The system says, no, this is against the international standards. That's number one. So SHA will not, that set of claims is rejected. 2, even you, a claim form is a legal document. It's attached to the Social Health Authority and Social Health Insurance Fund legal documents passed by Parliament. Now, if you go to your, for example, to your doctor, in Nairobi, in Karen Hospital, in Aga Khan. The claim form is filled by three different sets of people. The patient, you fill the first part, your name, your BO box, blah, blah. The second part is filled by your doctor. And the third bit is filled by the hospital administrator, who will ultimately work with the claim officers in that facility to ask for reimbursement. So what happens when all the claims form from a particular facility is filled by one person, same handwriting, same biro pen? That claim form is automatic.
How can you tell? How can you tell it's the same person, same biro?
You can tell the handwriting. What's wrong with you? You use your eyes. The handwriting of a doctor, the handwriting of a patient, the handwriting of a hospital administrator cannot be the same. What's wrong with you? Have you gone to school?
Yeah.
Yeah. It depends on your grades in handwriting. Secondly,
yes.
And let's continue, when you claim for a surgery, and you have seen when patients are being wheeled to theaters, there's a file on their bed.
Yep.
Those files are called theater notes. And the doctor, after he does the procedure, he will fill, and those are what we call theater notes. For this insurance company, for the social health insurance company to pay you, to reimburse you after you claim, you must provide theater notes.
Right.
Okay?
Yep.
So if theater notes are missing, then will SHA pay? No.
So how come they got away with this?
Just a minute.
How was this looted? That's
Just
what
a
I want to
minute.
know.
That's rejections. The 11 billion is rejection.
Well, it's not rejection. It was looted.
By, when okay, now let me help you with this headline. I can see you are referring to it many times.
Yes.
So that we move.
Yes.
When we rejected 6.8 for private health facilities, 2.8 for public health facilities, the counties, 500 million for the referral hospitals, 1.1 for faith-based. When you combine, it comes 11 billion. Ideally, they were to be paid. Am I right?
Right.
But from where we sit, what they were doing was, if we paid this, then they were looting the Social Health Authority. Okay? So they wanted to loot 11 billion from the Social Health Authority. What helped us is the system, which was not there during the defunct NHIF. So the fraudulent characters who are working with the insiders within the insurance authority migrated to SHA. Little did they know that now we have the Social Health Authority as one entity, and we have the Digital Health Agency as another separate entity, but working together to make sure that digitization. Today we have something called Afya Yangu. You can download it. It's for patients. It shows your records. You can register. You can do pre-authorization messages you receive. Then we have the app Practice 360 for doctors. 38 systems brought together under that. So these rejections are among the reasons I've given you if you don't provide the right documents. Another key rejection I'll give you. If a mother delivers in a health facility, X, in any part of our country, private, public, faith-based, when a baby is born, there is a legal document that must be filled called birth notification.
Correct.
I'm sure if you go back to where you were born,
Yes.
at least I was not born in a hospital.
Where were you born?
I was born somewhere in the remote parts of northern Kenya. But I'm sure you are from you are living in the highlands. Sessional paper number 6. So if we trace where Jeff Koinange was paid,
yes.
where he was born,
Yeah.
you'll find a birth notification document.
Yes.
So when you present your claims for maternity to the Social Health Authority, you must attach that legal document, birth notification. When that birth notification document is missing, then the Social Health Authority leadership cannot exactly know if a child was born. So that is a rejection. That happened between October to this. If you now look at today our rejection rate at Social Health Authority and DHA, it has drastically reduced by about 51%.
Okay, but would you agree, Waziri, that Afia House is Mafia House?
When I went there, and I think I was here.
Yeah, I interviewed you, I think.
And at that time I denied.
Yes.
After 3 weeks, I realized there was some truth about why Kenyans called it Mafia House.
Yes.
But today is Afia House.
No.
Today it is. How do you know? I'm the one who works there from 8 to 5.
And you refuse to resign.
Resign? Why? Why should I resign? You know, there are reasons why one should resign. And in fact, I don't need to resign. If I commit anything contrary to my oath of office, there are various ways of dealing with me. Impeaching me by parliament, the criminal justice system dealing with me if I have integrity issues. I am a political appointee. The president can one morning say, I need another minister for health. But let me go. You know, Jeff, Social Health Authority, which is 14 months old, which has replaced NHIF, which had less than 9 million Kenyans. Today's share has 29 million. Okay? NHIF annually used to collect about 39 billion. In 14 months, share has collected 130 billion, has paid 93.4 billion. It has served 80 million primary health care at facilities, 8 million Kenyans at the primary health care facilities, which is free, funded by the exchequer. And the news story in town since I left you is people were still charging Kenyans outpatient at level 2 and level 3 for dispensary health center. Now we have introduced something called the green label, walk in, walk out. We started with the Bomet Health Center. And the charter says, you as a citizen, you all need to register as SHA, don't pay the premium, be a member. For small ailments, you know, homa, malaria, you go to the hospital, you get lab tests, you see a doctor, you get medicine. Then you come to those who require specialized treatment, the Social Health Insurance Fund, who pay the 2.7%. You pay.
We all pay.
You pay, all pay, where you can go to any level 5, level 6, level 4 hospitals, public, private, faith-based. And in these hospitals, when you go for specialized treatment, unlike during the NHIF, there is a new program that the government introduced called the National Equipment Program. Now, all our counties, over 120 facilities in our country, county facilities, and 6 of our referrals have the latest equipment. Hospitals must have equipment. Hospitals should not be buildings. It's only hotels who are buildings with beds. But for a hospital to be called a hospital, equipment is imperative. So today, if you go to Lamu, King Fahd, where people used to come all the way to Mombasa or Malindi, today King Fahd, I'm giving an example, has an ICU facility, has a theater, has an oxygen plant, has a pediatric wing, has a private wing. Now you'll find CT scan, dialysis machines, mammograph, all those machines, theater machines in all our sub-county hospitals. I told you 120, and we're putting more. Our referral system to Kenyatta Hospital, to big hospitals, has reduced by 60%.
Tell me something, Waziri. You talked about 29 million Kenyans on SHA, right?
Yeah.
Other than those who have registered, how many are paying?
Those who are paying, you know, there are three funds. The primary health care. It is free. It's walk-in, walk-out. It caters for outpatient. And today, 67% of Kenyans have shifted to the primary health care at the county level because they can go nearby dispensaries and health facilities. Then we have the Social Health Insurance Fund. About 3.8 million Kenyans in the formal sector pay. Now we want to increase the compliance rate. We want to make sure that more institutions, we want to introduce agency model where we create agency, we look at how many people work here. We want Kenyans who are in the farms. If you have a farm and you have staff, you pay for them. You know, like the agency model of the KRA.
Yeah.
And you know how many Kenyans have accessed that chief?
Go on.
The specialized treatment since SHA started? About 3.4 million Kenyans. Finally, let me tell you, the whole concept of the universal, the Taifa care, was to make sure that we break these rich hospitals for the rich and hospital for the poor. Today, a Kenyan can walk to Aga Khan, to Nairobi Hospital, to Kenyatta Hospital, level 6, access dialysis, paid by SHA for both the 2 sessions. I can see you're busy with your phone.
Yeah, because I'm getting so many messages here.
Yeah.
So many messages. People are not happy.
Please,
like Stephen Jao is saying, I got deducted 800 shillings and SHA doesn't pay for me anything anywhere. They even don't have an option of choosing the hospital. Bure kabisa.
No. What is 800? There's nothing called 800. Either you are formal, 2.7% of your income, or you go through the SHA lipa pole pole. There is no 800.
Okay, but he says he went to Kenyatta last week on Thursday, and he spent 21,000 shillings, and SHA didn't even pay a cent.
He is not a member.
What do you mean?
He's talking of 800. Which rate is he talking about? Is he in Kenya? Maybe he's in South Sudan. Listen,
yeah.
You work for Royal Media.
I get deducted.
2.7% of your income.
Yeah, 2.75.
That is not 800. If you are in the informal sector, Mama Mboga, Kenyans border, they go through the mean testing. They go through the lipa SHA pole pole. They pay 4 months. Then they balance. They can pay slowly. So 4 months cannot be 800.
Maybe he's in the informal sector, and by the way...
No, it's not 800 then.
Huh?
It can't be 800.
Okay, how are you going to target the informal sector?
That's why I'm telling you. SHA Lipa Pole Pole, which was launched by the president in June of last year during the Madaraka Day in Homa Bay.
Yeah.
As of today, this evening, 420,000 Kenyans have enrolled into that, paid 1.4 billion shillings, and they're accessing specialized treatment.
John Geshui.
This was not there before.
John Geshui Mboro says there's no cancer treatment drugs in Kenyatta National Hospital. Yet in private hospitals, cancer patients are suffering. What's happening?
You know, number one, cancer is a very serious disease, and I'm focusing on cancer, maternal mortality, and child death mortality rates. Yeah. But cancer, every year we estimate about 44,000 Kenyans
dying.
No, 29,000 die. Okay, and not only us; it's a global figure. In fact, it's raising up. And that's why the president, in his wisdom, at the State of the Nation address, he increased the SHA package, reimbursement package for cancer patients from 550 to 800. At 550, it was above the former NHIF. But when we studied and we felt they need more sessions, we took it to 800. Let me give you the good news. Roche, you know, Roche is one of the major world pharma companies.
I know.
There's a drug that they make for breast cancer called Herceptin. It was, when I was coming to office, it was at 120,000 per drug, per session. We signed an MOU. Today, it's being sold at 40.
40 what?
40,000, and paid for by SHA. When I came in today, you can walk into Aga Khan, you can walk to Nairobi Hospital, you can walk to Kenyatta Hospital, do a kidney transplant, as long as you come with a donor. Both pre, post, and during the transplant, at the cost of 1.2 million shilling, fully covered.
By SHA?
Yes.
Okay. Speaking of SHA, teachers are complaining that SHA is not working for them.
You know, Jeff,
Huh?
Jeff, I will not allow you to do this.
Help me.
Teachers today, call Nat, call Kupetia. Teachers today are the happiest.
Come on.
Let me tell you, today we have in the scheme, the teachers' medical scheme, 415,000 teachers in our country. When they were under the private medical insurer, they could only access 800 facilities and one level 6 hospital owned by the person who was the provider. Today, teachers in our country access more than 9,000 facilities, both public, private, faith facilities. They access all the level 6 hospitals in our country. They can go to Aga Khan, they can go to Kenyatta, they can go to Nairobi Hospital. Today, teachers have got 2.7 medical cover for foreign treatment. Today, some of the teachers in different grades, maternity package benefit is 120,000. Teachers are very happy and they're dependent.
So why are they complaining?
And in fact, we are bringing the police and the prison to SHA 1st of June. We're now analyzing the data. We are putting all their dependents into our digital system. By 1st of April, 139 police officers and prison officers and their dependents will be handled their insurance by the social health.
Only 139?
Yeah. Both.
And the rest?
And no, that is the number.
139,000?
Yes.
Aha.
Both the police and their dependents. Now we are doing the data and making sure their biometrics match with the National Registration Board.
What about claims of ethnic discrimination during recruitment?
We have not recruited. By the way, let me tell you, let me have an opportunity. What was in the social media is fabrication.
Oh, come on. Come on.
It's fabrication.
You're saying where there's smoke?
You know, SHA is not part of royal media.
No, it's not.
SHA is under the Ministry of Health.
Yes.
The buck stops with me.
Correct.
And as I said over the weekend, on Monday they briefed me. So I have more authoritative, I have more local standard on SHA than you. So you listen to me so that I inform the people of Kenya.
Yes.
That list, number one, NHIF used to had a bloated staff of 1,800. Because SHA systems is more digital and working with digital health. SHA will only have 851 staff.
From 1,800?
From 1,800 to 851. The 851, so far, they have recruited 144, which is equivalent to 17%. So 83% of SHA staff have not been recruited. In fact, they're doing the shortlisting for about 451. Support the senior at the counties.
Yes, yes.
So the list, which was it was misleading, fabricated. You know, our competitors are wondering in 3 years, and this is the problem, you know, President Ruto is facing. Let me talk to you as a very senior, seasoned politician.
Yeah.
The problem President Ruto is facing from his competitors, more so some of, like my friend and former president, Uhuru Kenyatta.
Your good friend?
Our good friend.
Your good friend?
No, both of us.
Both of us.
You is your friend and your relative. But my good friend.
Yes.
Is a legacy problem. Because this universal health coverage could not take place during President Kibaki. And you know the reasons. The private insurers were buddies of President Kibaki.
Yeah.
You know them.
Yes.
So the Ngilu bill was dropped in cabinet. President Uhuru tried the pilot, Kisumu, Machakos, Nyeri, and Isiolo. He had the will, he had the commitment. But the same cartels in the NHIF frustrated him. He dropped the ball. President Ruto, in 3 years, has registered 29 million Kenyans into the social. Let me finish. The legacy issue. President Ruto, today, I think the housing, the affordable housing, going on around our country, whether it is hostels, whether it's markets, whether it's affordable housing, is about 630 billion. Not borrowed from IMF, not the World Bank, Kenyan money, housing levy. President Ruto has fixed the education model that, you know, when I see somebody like Fred Matiang'i, I wonder. Fred Matiang'i is a brainchild of this CPC when he was a Minister for Education. And later, my sister Amina. Fred Matiang'i messed up that CBC. We are fixing his mess. It's not working.
It's not working.
It's
a mess.
Today at 93%.
It's a mess.
Listen, you know.
Grade 10 is a mess. Kids can't go to school.
You know, Jeff, you like using very strong adjectives. It's a mess.
Yes.
Looting.
Yes.
You know, those words of yours, you know, are hollow. You're my good friend. So, it's a legacy issue. You go to Galana. Go to Galana, please. That's where my camels are, around there. You can go there. If you see that over the 500,000 acres being irrigated, in 3 years, look at the way he stabilized the economy. It has never happened in the history of Kenya.
That was a white.
No. It has never happened. And you know, it's good. These are facts. You have invited me to talk to you facts.
Yes.
It has never happened in the history of Kenya for the shilling to be stable at 130, 129 for 3 years. Ask any importer, any exporter.
Okay, I want to take a break.
For the economy. So President Ruto, some people cannot believe he is fixed and he defined his legacy in 3 years, that some people could not do it in 10 years.
Okay, I want to take a break, come back, and I want to talk about, you know, this 11 billion shillings. It's still bothering me very much. By the way, it's 8% of the health budget. 11 billion is 8%.
It's not 11 billion loss. I told you these are rejections.
11.6 billion.
No, 11.6.
How do you lose 8% of your budget?
No, who told you?
What do you mean, who told me? It's all over the place.
Listen, don't read the line. 11%. And we'll still reject. I told you it was 11 billion. Today it's 11.6. So the system rejects. As we are sitting here, if it picks a fraudulent claim, it will reject it.
Okay.
So I told you, out of this 11 billion, 6.8 of the private hospitals we have rejected. We will not pay.
2.8 of public.
2.8 of the counties.
400 million of whatever.
Yes. The 1.8.
Is there going to be punishment for the hospitals?
They have to. No, of course, there are some already we have handed over. I told you.
The files you took.
I told you 2 former CEOs of SHA before Massimo Ngangi are already facing fraud charges, abuse of office.
All right. Cabinet Secretary for Health, Aden Duale, is in the House defending himself.
No, I'm not defending.
You're defending.
I am giving facts.
11 billion shillings.
I think
looted.
No, let me tell you.
He says rejected.
We
say looted.
You know, we have. In fact, by the way, let's do this. There's rejected ones. There are some where documents are missing. The law gives you 14 days. We return the document through the system that these documents are missing, which we are not rejecting. If you bring the documents within the 14 days, we pay.
And money is missing.
No, you know, like your facility, for example, X. If you send us documents and we feel maybe your invoice is missing, itemized invoice is missing, the system tells you you have 14 days to bring back. If you bring it back, we pay. Then there's what is called clinical review of the system. The system will say the pattern in this facility. You know, like I can give you an example. In Duale, and I'm sure he's watching me, and we are catching up with that person. There's somebody whose dependents, his children, were 371.
Yeah. I saw that.
You saw that. Once we get all of him, we'll take him to the DCI.
Straight.
And he must show us the 371.
Children.
Yes,
Maybe his father, Abraham.
I don't think so. The only person in Kenya I can remember is Okoku Danger. And Okoku Danger didn't have 371. How many do you have? I have 5.
Oh, well done.
I'm better. At least I'm better than you.
You are.
Secondly, let me tell you, which is also very, very important.
Yes.
We have also, the system has also picked a pattern of doctors who you will find them in Homa Bay today, tomorrow you'll find them in Siaya, you'll find them in Garissa, you'll find them in Mandera.
In Wajir.
In Wajir, about 30 plus have been denied the access code of SHA. About 22 or something like clinicians have been denied. We had 6 facilities in a county where patients, 300 patients, were going through one day. So digitization is the key. So it picks patterns. It says, why is Jeff Koinange going to this facility every day, even in the primary health care? Yesterday, we found a facility in one of our county, and we want to see the governor, where, and this is where walk in, walk out, outpatient, which is free. And we have seen Jeff is in the morning, he's at lunchtime, he's at 5.
Same person?
Yes, same person, which means it's part of the fraud.
Of course.
Yeah.
Let me take a break. Come back. Do you think the Cabinet Secretary for Health, Aden Duale, is clinically lying to us?
I've never lied. You know that. Look at me in the eyes. I have no scandal, you know that.
I know that.
Yeah, at least I have no scandal.
Yeah, no scandal. What are your thoughts? Send your thoughts, comments, questions at Koinange Jeff, at Citizen TV Kenya, the hashtag JK Live. JK Live takes a break. We'll be back in a moment.